Hi everyone, and welcome back to my YouTube channel. Greetings to you all. I hope you all are well today, and I hope you all are taking good care of your health. If you are new, special welcome and thank you to you. I am Regina Umadu, a pharmacist. In today's video, I'll be discussing about STDs or STIs, sexually transmitted diseases or sexually transmitted infections. They are the same thing. In this video, I'll be discussing them generally. It's going to be about general because there are so many diseases that comes under STD. In this, I'll be listing the STDs. I'll be discussing the causes, the symptoms, the risk factor, the complications, and preventions. When I'll be discussing them individually is when I'll be talking about their treatments. So watch this video to the end. Let's dive in. STD, which is sexually transmitted diseases, are diseases that are contracted through sexual intercourse. But this doesn't mean that it can only be contracted through sexual intercourse or it can only be transmitted through sexual intercourse. Diseases like HIV is STD, but can also be transmitted through other means. Just like the name implies, is sexually transmitted. This means that this disease is in the blood or in body fluid, and whenever you have exchange of body fluid with someone who is infected, you can contract it. And sexual intercourse or sex is one of the means through which you can exchange body fluid with someone. STDs includes HIV, gonorrhea, syphilis, chlamydia, trichomoniasis, hepatitis like hepatitis A, hepatitis B, hepatitis C, human papillovirus, Hep's virus, pelvic inflammatory diseases. All these are STDs, but they are not all transmitted through sexual intercourse. So what are the causes of sexually transmitted diseases? It can be caused by bacteria, virus, or parasite. Diseases like gonorrhea, syphilis, chlamydia are all caused by bacteria. STD like hepatitis, human papillovirus are caused by virus, and trichomoniasis caused by parasite. What are the symptoms of STD? Remember that I'm talking about general. Sometimes STD doesn't show any symptoms. That means that someone can have STD without knowing it. It's not like malaria or throat infection that when you have exhibiting some symptoms that you yourself will suspect something and go to the hospital to know what is wrong with you. In this, you can have STD and you will not have any symptoms, and you won't even suspect anything until at the last stage when it's become complicated or when it's become critical. But symptoms usually occur few days after exposure. That means few days after you must have contracted the STD, you start exhibiting some symptoms, and some of them can even take years before it will manifest. Example being HIV. It doesn't always show symptoms until after some years. Generally, the symptoms of STD are sore or bump at genital areas or in the mouth or in the rectal, pain or burning sensation during urination, smelly discharge from the vagina in women, discharge from the penis in men, pain during sexual intercourse, lower abdominal pain, swollen lymph node, especially in the groin, unusual vaginal bleeding, and rashes in the trunk or all over the body. If you observe any of these symptoms and you know you are sexually active or you have more than one sexual partner, you should go see a doctor, because you cannot sit at home and say, oh, I don't have STD or I cannot have STD. It doesn't show on the face. They don't write it on the face, and some of them doesn't show symptoms. So it is possible that you see a very healthy person, you won't even think of any disease, but they are having STD, and that makes the spread very easy. What are the risk factors? What makes someone susceptible to have it is having more than one sexual partner, that is having multiple sexual partner, practicing unprotected sex, use of alcohol. Why is alcohol blamed here? Because It is blamed because when someone, if you drink excess of alcohol, you'll be drunk. That means you will not be with your right senses, and this can lead you to do things that you shouldn't, including picking anyone on the road and having sexual intercourse with them, or accepting to sleep with anyone as a woman. And another risk factor is being raped. Sad enough. Another risk factor is having history of STDs. If you have had sexually transmitted diseases in the past, there's chances that you can easily contract other ones. And another risk factor is being young. Yes, being young, meaning that people from the age of 15 to 24, they're young girls, they want to enjoy their life, they feel like their immune is very strong, they can't easily be affected by disease, they're not old. And during this time, people can easily do all sorts of things in the name of being an adult or growing up. Because of this, they can easily contract STD. But what are the complications? The complication means if it's left untreated or if it is diagnosed late. Number one is infertility. Yes, some of this STD can lead to infertility, either from man or from women. Arthritis, that is this inflammatory disease that will cause pain in the joint. Pelvic inflammation in the eyes. Some STD can also lead to heart disease. And finally is certain cancer, especially cervix or rectal cancer in case of HPV, that is human papillovirus. So what are the prevention? The prevention is to abstain. That is it, abstain. If you're not married, abstain. If you're married, have only your wife. Don't have multiple sexual partners. Practice safe sex if at all you must do it. Wait and test yourself before starting sexual intercourse with a new partner. I know this is very kind of sensitive because telling someone that let's go and do STD test, someone you just start relationship with, is kind of awkward. But yes, you should. Before you engage in any sexual intercourse with someone, you should undergo screening just for your own safety. And if you're the type that will think, oh, don't you trust me, why should we even do that? Don't take it personal or try to think about it or see it in different view. Just say that it's necessary just for your own safety and the person's safety. I know because of the stigma attached to sexual transmitted diseases by the society, people don't feel free going for the test or discussing about it at all. But for you to be on the safer side, it's better you do that than exposing yourself and your life because of what people will say. So another thing is to go do checkup regularly. If you know you are sexually active or if you're not sure of your status in STD, you should go do screening so you will know, so that you will not know about it when it's at the last stage. A stitch in time, they said, saves 9. It's better to go get yourself tested and be sure you don't have any STD, okay, before you engage in any sexual intercourse with anyone, so that don't think that you don't have STDs in your family, therefore you cannot have it. Don't think that because you don't have any symptoms, there is no need for you to go. Don't think that, oh, what if I test positive? What will become of me? What my friends say? What will my family say? Don't think about it. If you feel within you have the needs, just go and test and be sure and free yourself from anxiety that will come. What if it tests positive? Or if you have the symptoms and you're unsure, just go for diagnosis. The only way you can be sure is to be tested. So there is no need of living in fear, anxiety, or tension over things we are not sure of. And it's not like if you contract it, that will be your end. STD is treatable and curable. Yes, even HIV that is not curable, it is treatable. You can, someone with HIV that start treatment as early as possible, even if they don't start it that early, can live a very normal life with drugs. So don't think that if you test positive, then that will be your end. No. Also, if you are the type that judge or see STD to be some kind of big punishment to offender, especially those that run around, it's not. There is chances that someone can have one sexual partner and the sexual partner misbehave and they can contract it. There's a chance that someone can sleep with someone they think is healthy enough, not knowing that they have it, and the person on their side also. So it's not a disease that only those who run around contract. That is why I said in the first place, or in the first step of prevention, is to abstain. So don't judge those who have STD, because if you judge less, you won't bother much being judged. And I'll use this chance to say that those who have family should be faithful to their wives and husbands and not run around. Practice fidelity. Infidelity destroys. Apart from the pain of cheating, you are exposing yourself and the person you truly love to disease. I hope you all enjoyed this video and you found it useful. Please, if you do, give me a thumbs up, subscribe to my channel. It's for free. It will not cost you anything. Also, comment your view in the comment section below. Thank you for watching. Do take care of yourself and have yourself a good day. Bye bye.